Hello friend, today we are discuss about the shock, types of shocks, causes of shock and pathophysiology of shocks. Before starting the lecture, please wear Bluetooth or headphones for clear and better understanding the lecture. So let's start the lecture. Shock. Shock refers to a critical condition where the body's vital organs and tissues do not receive enough oxygen and nutrients due to a significant drop in blood flow. This can lead to a cascade of physiological failures and, if not treated promptly, can be life-threatening. Types of shock. 1. Cardiogenic shock. Severe heart-related issues, such as a heart attack, leading to inadequate pumping of blood by the heart. It refers to cardiogenic shock. 2. Hypovolemic shock. Significant loss of blood or fluids due to trauma, surgery, severe dehydration, or burns. 3. Distributive shock. It divides into subtypes. A. Septic shock, caused by a severe infection triggering widespread inflammation. B. Anaphylactic shock, extreme allergic reaction causing a sudden release of histamines. C. Neurogenic shock, resulting from spinal cord injury or severe emotional distress affecting the nervous system. 4. Obstructive shock, obstruction that hinders blood flow, such as a pulmonary embolism or cardiac tamponade. 5. Mixed shock, involves a combination of different types of shocks. Factors. Causes of shock: trauma, injuries, or severe accidents. Heart-related problems like heart attacks. Severe infections leading to systemic inflammation. Allergic reactions causing anaphylaxis. Conditions obstructing blood flow, such as pulmonary embolism. Risk factors for shock. 1. Age. Infants and the elderly may be more vulnerable. 2. Chronic health conditions. Individuals with heart diseases, diabetes, or other chronic conditions may be at higher risk. 3. Trauma. Accidents or injuries that result in significant blood loss or tissue damage increase the risk. 4. Surgery. Surgical procedures, especially those involving major blood vessels, carry a risk of shock. 5. Infections. Serious infections, particularly if not promptly treated, can lead to septic shock. 6. Allergies. Individuals with severe allergies are at risk of anaphylactic shock. 7. Dehydration. Lack of fluids in the body can contribute to hypovolemic shock. 8. Medications. Certain medications, if not properly managed, may pose a risk of shock. Understanding these types, causes, and risk factors is crucial for early recognition and appropriate management of shock in various clinical settings. Pathophysiology of shocks. Underlying cause. This represents the primary reason for shock, such as infection, trauma, or other triggers. Decreased blood flow. Due to the underlying cause, there is a reduction in the overall blood flow throughout the body. Compensatory mechanisms. The body activates mechanisms to compensate for reduced blood flow, including increased heart rate and constriction of blood vessels. Insufficient oxygenation and nutrient delivery. Despite compensatory efforts, the decreased blood flow leads to inadequate supply of oxygen and nutrients to organs and tissues. Organ dysfunction and cellular damage. Prolonged inadequate perfusion results in dysfunction of vital organs and cellular damage.